Hello, this is another segment in my breast reduction and tummy tuck video diary. In this segment I'm going to be talking about supplies and preparations for surgery. I will preface this with the statement that I am a big over planner with things that I'm excited about. Things I'm not excited about, I'm a terrible procrastinator, but I'm excited about this. So I like to have everything I could possibly think I might need. I understand that may mean that I'll have things that I don't use or that I don't need, and I will certainly check back in and let you know what was most helpful and what was unnecessary. Um, but I'm okay with the possibility of being over-prepared. I do not think that everybody needs everything that I'm going to have. I know lots of people get through this process with very minimal supplies and do just fine, and I have no problem with that. This is just what works for me, so I thought I would share a little bit about what I've put together as I get closer to surgery. I'm still 57 days away, but I am trying to get some things together so that I can just mentally set things aside for a while and feel comfortable knowing that I've done some prep work, and then not obsess for a few weeks and then pick it back up closer to time. So first I'm going to talk about a couple of big items. One is that I would really like to have an electric power lift recliner. If you Google that, you'll find that these recliners are not just normal recliners. First of all, they're electric, so I don't have to reach down and pull a lever. They go almost completely flat. In fact, some of them actually will put the head down a little bit lower than the feet, specifically to help people recuperate from things. But more importantly, they also, when they go up to a seated position, they'll actually lift up off the floor to help you get to a standing position. Again, you can get by without it, absolutely, but I think it would be a nice thing to have. They're very expensive to purchase, so I've looked into renting them or buying a used one. I found a place here where I can rent one for $175 for a month, plus a $65 delivery and pickup fee, and that's a one-time fee. So for 65 bucks, they'll drop it off and they'll pick it up at the end of your month. But I've also found some inexpensive ones for sale on Craigslist used. I haven't actually gone to go look at any of them yet. The thing about something like this, it's not something I can meet someone in a parking lot to look at, so you have to use some caution whenever you're shopping on Craigslist. But I have bought a lot of furniture on Craigslist in the past, so I think it's worth investigating. So I found a few that were as cheap as $150. One that I'm looking at right now is $300. I'm going to try and go and see that this week, and then, it's not something I probably would need after I recuperate from this, so I may sell it, but then I can recoup some of that money. But that's kind of the biggest thing I think that I need to get in place for me to feel comfortable. I'm also going to have a walker and a cane, some sort of a shower chair. I'm going to see if I can fit a cheap plastic lawn chair, just those plastic white ones, into my shower. I have a really small shower, unfortunately, so I'm not sure if it'll fit, but I'm going to try that before I spend any more money on that. The walker and the cane are going to be borrowed from a friend who went through this procedure. She said the walker was a huge help, just to be more mobile without having to rely on other people, and also to get on the toilet, to be able to sit down on the toilet and stand back up. I think that would be helpful. I don't know that I'm going to worry about a toilet seat riser. I think if I have the walker, I'll be okay. The walker is also important to me because I have dogs, and one of my dogs loves to love me, and one of the ways she loves to do that is to jump up on me and put her paws around my belly, and I'm trying to train her not to do that, but the walker is going to be necessary to keep her from, getting tangled in my drains. Oh my God, that scares me. The thought of that scares me. I also want to have some sort of a lap desk for when I am in my recliner, again to kind of protect my lap from the dog, but also just to have a surface to work on. So I've looked at some of those on Amazon. Okay, and in terms of other supplies, I have started my box. It's a big box. This is my box. I found a great source. Just looking around online, there's a plastic surgeon in Knoxville, Tennessee. His name is Dr. Reath, R-E-A-T-H, and he actually has a store on his website, and he sells like plastic surgery recovery kits for different kinds of procedures, and you can also buy items a la carte. So they had a breast reduction kit and a tummy tuck kit. there was a lot of overlap between them. So I just got the breast reduction kit, and then I added a couple of things so that I'd have kind of stuff for both procedures. You know, it wasn't cheap. It was a few $100s, but I feel like I got a lot of stuff that I was going to buy, and I did get a discount for buying it all together, and I got free shipping. And it came with this lovely 40-page plastic surgery planner. I really didn't know what to expect. I didn't buy it because of that. It just showed up, you know, on the confirmation. It said I was going to get it. This is apparently something that he gives, and I guess this is probably backwards, but this is something he gives to all of his patients. And it's basically just this booklet that is just all kinds of information about recovery. It's really nice. As much as I like to do in-depth research, my husband, he doesn't want to spend hours poring over websites with me, and my stepmom's going to help care for me. She's, you know, wants to know a little bit more, but this is great for family members, caregivers to read. It talks about the emotional roller coaster. It talks about what you need. It talks about what to expect in terms of time frames of recovery. It talks about drains. It talks about scar therapy. It talks about having sex afterwards, like when can you do that and what you need to look out for. I thought it was really a lot nicer than I expected. Section on showering after surgery, you know, and this is something obviously to use in conjunction with your own surgeon's advice. I think when there's a conflict between what you read on the internet and what your own surgeon says, you should do what your own surgeon says. If you've picked that surgeon, you should have faith that what they're advising you to do is what they've personally seen works, that it works in tandem with their techniques. But I didn't see anything in here that contradicted him in my case. So I was really excited about this, and I think it'll be a great resource. Sorry about that. One of my kids was calling. So yeah, I again think this is awesome, great for sharing with family members who need to know a bit about what's going on, but maybe don't want all the nitty-gritty gory details. So in the breast reduction recovery kit, there was a surgical bra. I got that. It looks impossibly small. I did put it on. I had to. It's got Velcro straps, which I thought was kind of interesting. It fit better if I loosened them. You know, it's obviously not very supportive. It doesn't have any wires in it. What's kind of neat is that the seams are on the outside, which makes sense. You wouldn't want those seams in the cup of the bra to be irritating your incisions. It's soft. You know, it seems fine. It wasn't that expensive, even if you purchased it separate from the kit. It's obviously a front closure. So I have tried it on. I can get it on. Obviously, it doesn't offer a lot of support. I probably will take a picture with it on before and after. I will have a different surgical bra that I will wear out of the hospital. This is just going to be for a backup. Once I'm able to shower, I'm going to probably want to keep a cycle of keeping them clean. I also got a spare abdominal binder. This is again like the basic. It's foam and it's two big elastic straps with Velcro. This should be just like the one that I will wear out of the hospital. Again, this is just a spare so that I can always have a clean one after a shower. This is just a folder where I've got all of my paperwork for surgery in it. Being a little bit ahead of the game, this is silicone strips, scar therapy. I know I'm a long way from needing this. It'll be weeks and weeks and weeks after the surgery before I can even think about this. But it was part of the kit, the breast reduction one. You can see it's the anchor-shaped scar therapy strips or silicone strips within the little circles for the breast reduction incisions. And this is the tummy tuck one. It's just one real long strip that hopefully will cover the whole incision. There's also a TheraPearl pack. This is part of the kit. This is a large one that's got a strap on it. Stuff's real soft. It's basically like frozen peas except better, and you can also heat it up, but I anticipate using it as a cold pack for swelling, although I might end up heating it up and putting it on my back if my back is really sore and I feel like I need heat. This is a bottle of probiotics. This is supposed to try and help me get ahead of the game with the antibiotics and the painkillers and the number that they do on your digestive tract. Hopefully the probiotics will help me to not get all plugged up with that stuff. Of course, in addition to this, I will also be taking something like milk and magnesia and stool softeners. Keep things moving. I also have a bottle of bromelain with quercetin, maybe. I'm not sure if I'm pronouncing that right. This is for to help with swelling, and I'm supposed to start taking this after surgery. This is a bottle of Arnica montana. This is another herbal supplement. This is supposed to help with bruising. The thing that's interesting about Arnica is that my surgeon is recommending that I start taking this 3 days before surgery. And I've read other surgeons online that recommend the same thing, but I've read just as many other surgeons from talking to people online who absolutely say do not take this before surgery because it has blood thinning properties. So I'm going to ask my surgeon why he wants me to take it 3 days beforehand, and then I'll do whatever he tells me to do. But this is definitely something that surgeons seem to feel strongly one way or the other about, so don't take this without telling your surgeon you're taking it and following his advice on it. Maybe it makes a difference, you know, maybe different surgeons seem to prescribe different kind of cocktails and medications with these processes, so, you know, maybe it depends on that. This is the VitaMedica Clinical Support Program. These are 2 bottles. There is an evening formula and a morning formula. And these are supposed to be kind of all the things that your body needs for the best possible healing. I've read really good reviews of this online. Again, this is something I will share with my doctor before I start taking it. But from what I understand, there's nothing in here that's on the do not take list prior to surgery. What the VitaMedica people suggest is that you start taking these 1 in the morning and 1 in the evening, 2 weeks before surgery, and then continue taking it for 2 weeks after surgery. So there is 4 weeks worth of these. And I'm not sure what the difference, I think the evening ones, there's some stuff that helps you sleep, and I'm not really quite sure what the difference is between the morning and the evening, but they do have different things. I'm not getting a lot of bandaging and first aid stuff. I'll wait until after my pre-op appointment. I did get some gloves because my stepmom is going to be helping me, and if she helps to do my drains and stuff, I figured she may not want to touch my, you know, drain fluid. So I got some gloves, I got some Bactrim antibiotic ointment. I got some butterfly closures. These things scare the crap out of me. One of my biggest fears is wound opening. But it seems to happen with some regularity. It's not an uncommon issue. I wouldn't even call it a complication. I think it happens. You know, I've read lots of women who've had small openings in their wounds during the course of recovery. So I wanted to have these on hand because if it happens, then I'll have them on hand. But also if I have them, maybe it won't happen because, you know, you always need things you don't have. So I read about this recently. Again, I will talk to my surgeon. This is the sort of thing, it's not a bad idea to have in the house, so even if I don't use it, it's not like we can't use it. It's a pain relieving and itch relieving spray. I've read lots of women complaining about itchiness around their incisions. Itchiness is a side effect of medications. I also have some Benadryl in my box if I have itchiness from medications. But I've read that several people swear by this stuff to help with the itchiness around incisions, itchiness caused by the tape from the bandaging. Here's the Benadryl, some gas relief, because I'm worried about that. We had a grabber bar. This was actually, I saw this on a sale rack, clearance rack in some store. I only paid a couple of dollars for it, but it's one of these, you know, handy dandy grabber bars. Again, it may be a silly thing, maybe won't ever need it, but if I end up being by myself at some point, my stepmom will be here for a few days. Our kids only live with us half the time. I'm in a blended family, and my husband will be at work. If I drop something on the floor and I can't bend over and get it, then this will come in very handy. Alright, that's pretty much it in terms of what I have right now. I also have some clothing items, but I won't go into too much. I've got some camisoles, some really soft camisoles to wear underneath the compression garments to keep from skin irritating. I got some nice soft pajamas with a button down top, and I got a great tracksuit, you know, with a zippered hoodie that I'm probably going to wear on surgery day because it's super, super soft, very loose. So that's my box right now. I'm trying to think. I'll talk later about foods and stuff when I get closer to time and after my pre-op appointment, I think. But I hope that was helpful. If anybody has any questions or comments, just leave them below. Thanks.